As a mental health professional, you know the critical role you play in supporting those who serve, especially when it comes to assessment, treatment, and recovery. But with law enforcement and first responders, there's this whole other layer that often goes completely unaddressed.
The thing is, so many of the challenges officers face day to day, they aren't actually clinical. They're happening in real time. We're talking about leadership struggles, communication breakdowns, split-second decisions, and just that constant grinding exposure to stress. And that right there, that's the resiliency training gap.
So what happens when the biggest challenges aren't clinical? Well, your work in the therapy room is absolutely vital, but it can struggle to address the stressors that pop up in the middle of a patrol shift. You see, truly effective support, it requires a deep cultural understanding of law enforcement, the reality of the job, the toll of shift work, the whole command structure. Without that understanding, even the best clinical work can have a hard time translating into real-world impact. But when you get the culture, you build credibility. And credibility, well, that's what creates change. I mean, think about it. The sustained exposure to trauma, the physical and mental drain of shift work, and all the unique norms of a command structure, these are operational stressors. They demand a completely different kind of support, a sort of real-time resilience that those one-off training days just can't build.
And let's be really clear about something. This is not about a failure of officers. Law enforcement has some of the most resilient people on the planet. The real issue is a gap in the system that's supposed to be supporting them.
So what is this resiliency training gap? Well, it's that frustrating space between what an officer learns in a classroom and what they can actually apply out on the street. It's really just a chronic failure to make training stick where it truly matters most.
And listen, this isn't just a feeling. It is backed by some pretty stark data. Research from Harvard found that of the $365 billion spent globally on training, a staggering 90% of it is lost. It just evaporates. Only 10% actually makes it back to the workplace. That's a massive, massive gap between what we're investing and the impact we're seeing.
So why does this keep happening? Well, research points to three major system barriers. First, you have leadership that, often unintentionally, blocks change. Second, the system itself just lacks any real follow-through. And third, and this is the big one, there is a total lack of coaching to bridge that gap between learning something and actually doing it. And if you need more proof, look at the U.S. military. In 2022, after combing through 13 years of data, Walter Reed's big recommendation was for the military to shift its entire resilience program toward a leadership and coaching approach. Why? Because their key finding was simple. Without coaching, the training just doesn't stick.
Okay, so if the problem is a transfer gap, then coaching is the bridge. It really is the missing piece of the puzzle that provides the structured, consistent follow-through needed to turn insight into actual, real-world action.
Now, I know what you might be thinking, and it's important to be clear. This program is designed with very specific ethical boundaries. This does not replace therapy. It doesn't blur any clinical roles. What it does is equip you to support high-functioning individuals with performance, with leadership, and with resilience, all while maintaining the complete integrity of your clinical work.
Let me just say that again because it's crucial. This is not about replacing clinical work. It's about expanding your impact through a structured, non-clinical coaching approach that works right alongside what you already do.
Here's the thing. A systems problem requires a system-wide solution. It's not enough to just train one person here or there. You have to train the entire ecosystem, and that is exactly what this program is designed to do.
So let me introduce you to the Resiliency, Leadership, and Emotional Recovery for Crisis Response Pilot Program. It's an 85-hour ICF Level 1 approved coach training program, and it was built from the ground up specifically for these high-stress environments, like law enforcement.
And what makes it a systems approach is who we're training. We are bringing together 200 sworn officers, 50 retired officers, 50 mental health professionals, that's you, and 50 external coaches, all in the same training. This creates a true 360-degree support system that weaves together clinical understanding, coaching skill, and real-world application.
So, what's the end game? The ultimate goal is to embed formally trained ICF-certified coaches directly into law enforcement agencies. By serving as leaders and peers, they can help build systems that sustain resilience from the inside out over the long haul.
Okay, so that's the big picture. Now let's drill down. How does this actually expand your impact as a mental health professional? Well, for starters, this allows you to develop an even deeper cultural competence. It lets you extend your impact far beyond the therapy room and support individuals who might never, ever seek clinical care. You get to help translate insight into practical, real-time application and contribute to change at the system level, not just individual care.
And beyond that, it gives you a fantastic opportunity to diversify your professional toolkit. By adding formal coach training, you can expand the services you offer, you can work with people and organizations in a totally non-clinical capacity, you can develop your own coaching-based programs, and yes, you can create additional revenue streams, all while keeping those crystal clear boundaries between your clinical and coaching roles.
So what we're really talking about here isn't just another training opportunity. It's truly an invitation to help lead the future of officer wellness.
And it's a very unique opportunity. This is a nationwide pilot program, and it's limited to 350 participants total. Out of that, there are just 50 seats reserved for mental health professionals. This is a chance to be part of an inaugural group that is going to influence this profession for decades to come.
You know, we often talk about the bravery it takes for a first responder to finally ask for help. But I think the most courageous thing a coach can do is to get trained and to be ready when they do.
This is about so much more than just adding another modality to your practice. It's about fundamentally expanding your impact and contributing to a system that's truly designed to support resilience. So if you're ready to take your expertise to the next level, I invite you to learn more, review the program, and submit your application today.